Welcome to this webinar on slavery, race, and COVID-19. The unfolding coronavirus crisis has revealed deep structures of inequality apparent in the death toll in the United States and in other countries. The purpose of our seminar today is to examine the patterns of racism and legacies of slavery that have informed the pandemic, especially in the US and the UK. We've been joined by over 260 people who've signed up for the session via Zoom and many more via Facebook, where we're broadcasting live as well. My name is Daniel Carey. I'm director of the Moore Institute for Research in the Humanities and Social Studies at the National University of Ireland, Galway. Today's seminar forms part of a series that we've run on COVID-19. We've had previous sessions on politics, on data and ethics, on education and the response of writers. And next week, we're going to be looking at the Irish border as an issue during the crisis. And recordings of these events are available via our website and YouTube channel. I wanted to thank David Kelly, our digital humanities manager in the Institute, for his work on the series and for helping us today behind the scenes. We have an excellent panel of speakers today. I'll introduce them in the order in which they're going to be speaking. First of all, Kerry Sinanan. Kerry is based at the University of Texas, San Antonio in the Department of English. She specializes in 18th and 19th century transatlantic literature, cultures of slavery, and the Black Atlantic, including the British Caribbean. Her forthcoming book project, Ms. the Mastery, Traders, Planters, and Colonial Agents, 1750 to 1834, examines the writings of British enslavers in the period. She's published widely on abolitionism and slavery, and she was a visiting scholar at the Yale Center for British Art in 2017, where she began a new project on representations of enslaved mothers. She's a former visiting fellow at the Moore Institute. Koritha Mitchell is author of the award-winning book, Living with Lynching, and of the forthcoming book, From Slave Cabins to the White House, Homemade Citizenship in African-American Culture. We were talking earlier, and it's coming out in August, I'm delighted to say. She's an associate professor of English at Ohio State University, a board member for the Society of Senior Ford Fellows, and a faculty fellow at the Kirwan Institute for the Study of Race and Ethnicity. Enrico Lago, my colleague, is professor of history at the National University of Ireland, Galway, and head of the School of History and Philosophy. He's the author of 5 monographs on slavery from a comparative and transnational perspective, focusing on American and Italian history during the 19th century. Most recently, he's published Civil War and Agrarian Unrest, the Confederate South and Southern Italy. He's a member of the Royal Irish Academy. Eric Foner is one of the most distinguished historians in the US. He has served as president of the Organization of American Historians and of the American Historical Society. He's the author of numerous works on slavery and the period of Reconstruction, including books on Nat Turner and emancipation. The Fiery Trial, Abraham Lincoln and American Slavery won the Pulitzer Prize in 2011. Reconstruction, America's Unfinished Revolution, 1863 to 1877, won the Bancroft Prize. He is DeWitt Clinton Professor Emeritus of History at Columbia University. Our speakers will talk for about 5 to 7 minutes each, and we'll have plenty of time for follow-up discussion and questions. To ask a question or contribute, there's a Q&A button. There's also the chat function, and David Kelly can alert us to things coming in via Facebook. I wanted to thank Kerry for initiating today's session, and it's now over to you, Kerry.
Hello, and hello to everybody joining us, and thank you to my fellow panelists. I just wanted to start by thinking of some transatlantic connections between the UK and the US in particular at the moment. They both share pretty much the worst rates for dealing with COVID at the moment. That those data might change, but at the moment the UK and the US are sitting at the very top of an unenviable pile. They also share, of course, a history of transatlantic and plantation slavery that carried on from the 1600s to at least 1860, and those dates have been more fully highlighted for us by Hannah Jones's recent 1619 project, which of course won the Pulitzer Prize just recently. The UK and the US also share at the moment a white nationalist head of state and a strong current of rising racism born out of this kind of nationalism, a rising racist discourse. What they also share, of course, is a horrific rate among Black and ethnic minority peoples in terms of the death rate of COVID. In the US, the death rate among Black people they're accounting for a third of all infections and deaths, when in fact African Americans only make up 11% of the population. 72% of deaths in Chicago are Black deaths. Native American populations are also facing what one tribal leader has called potential annihilation. And at the moment, the Cheyenne River Sioux tribe are in a standoff with the South Dakota governor to maintain some sort of regulation of their own land in terms of COVID precautions. In the UK, Black, African and Pakistani death rates are 3.5 times higher than the death rate among white people. Black Caribbean people are twice as likely to die. So I'm just drawing out some of this data because this is no coincidence, is what I'm really thinking about today. This systemic racism that underlies these horrific outcomes, allied to a racist capitalist system that has its roots in slavery, are causing a disastrous situation to become even worse. Some of these economic legacies go back to the systemic process initiated by transatlantic plantation slavery of extracting labor with no care in return. And I think what's underlying a lot of the logic and the discourse that we see in the UK and the US at the moment is this idea that there's this endless supply of labor, the dream of this endless supply of labor that filled those slave ships. Around 22 million enslaved people were captured. Not all of them made it, of course, across the Middle Passage. And I just want to think a little bit about the slave ships hold as a space, because the paradox is that while we're all being asked to socially distance, of course, many people in prisons and detention centres, but also in meat factories, in Amazon workshops, these people cannot distance. And again, a lot of these ideas of packing people in and really denying them human rights and counting them as disposable. All of this, I would argue, has its roots in slavery, as does child separation at the border. I'm only 60 miles here in San Antonio from the Pearsall processing detention centre run by ICE, and women have been protesting there since April because they don't even have access to clean water. The NYPD has been blaming their own prisoners for spreading COVID because of drinking out of toilets. And again, this idea of dying because it's your own fault rather than because of the conditions you've been kept in goes back to slavery. And I'll just end my opening comments with a quotation from, this is Christina Sharp's book, In the Wake. And as she points out, in the US, Black death isn't an accident. It is systemic and it is required. The extra legal and sanctioned legal murders of Black people are normative for this so-called democracy and necessary. So yeah, as people are being forced back to work, people are being told to die for the economy, literally, by Governor Dan Patrick here in Texas said, there are more important things to life than living. And so I'll just end with those opening comments to just draw out some of the trajectories and outcomes that I think are rooted in systemic slavery.
Thank you very much, Kerry. Koritha, could we turn to you now?
Hello. Thank you very much for creating this opportunity. I'm really excited to be a part of this really important conversation with all of these scholars that I admire so much. As you shared in the introduction for me, I'm an English professor who studies violence. And so I'm going to really be sharing from that position. And part of what that means is that I understand physical violence and I understand discursive violence, both. I understand that actions are preceded by and supported by words that society considers to be valid. And that's really the position from which I'll speak. So I first want to just share some of the major lessons that I learned from writing my first book, Living with Lynching. Number one, lynching did not become anti-Black violence until after emancipation. And of course, one of the people to teach us this is Ida B. Wells, who just was awarded a posthumous Pulitzer Prize for her investigative journalism around lynchings. And she's one of the people who taught us this, that as long as Black people were enslaved in the United States, killing them was not as attractive as when they were no longer chattel, right? That if you killed a Black person who was enslaved, then you would owe money to their so-called owner. And so lynching as an anti-Black phenomenon really comes into being after slavery ended. So then that leads me to the second major insight that writing Living with Lynching gave me, which is precisely that lynching was a response to Black success. And I mean this in very incremental ways. When I say success, I don't mean that it had to be a grand success in order to inspire white supremacist violence. It could be a tiny success. So the success of having the country go to war over the question of slavery, the success of actually seeing emancipation, that legally you're no longer considered property, that is a form of success that lynching answered. When you have the 15th Amendment and Black men get the right to vote, that right to vote becomes a form of success that lynching wants to put in check. Ida B. Wells, again, was very clear that it was exercising the right to vote that most inspired this terrorism, this domestic terrorism of lynching. And she's also very clear that lynching started to really intensify in the post-Reconstruction era, right? Of course, Eric Foner has taught us all about that very brief, tragically brief period of Reconstruction. Lynching intensifies in the post-Reconstruction era. By the time the troops leave the South and basically say to Black people, if you want to be considered citizens, you're going to have to face all of the violence that is trying to convince you you're not citizens, you'll have to face that violence on your own. So the federal troops, the few that were in the South, leave and Black people are left to their own devices. So post-Reconstruction lynching intensifies with its first height in 1892. So again, I'm thinking about how lynching was a response to success. I'm going to keep you in your proper place by terrorizing you when you want to take advantage of citizenship rights, living as a citizen. And part of what this means is that the most common response to Black people being citizens, so for example, demanding a decent demanding a decent price for their labor, Black husbands trying to protect their wives and daughters from sexual assault. Those were the kinds of things that people were most often assaulted for. And so part of what this means is that my third lesson from writing Living with Lynching is that how you can talk about me determines how you can treat me. So when we see those pictures that were put in newspapers of lynch victims that were mutilated, how is it possible that white people can do that kind of thing to Black people, but the main people who are seen as criminals and barbarians are Black people? So that teaches me that how you can talk about me determines how you can treat me and still not be considered a criminal or barbarian yourself. So I want to just end by talking about how these lessons from Living with Lynching are related to what we're seeing today. And there are lots of things I could say, but the one message I want to leave with is that if we understand that anti-Blackness is about opposing Black success, then it's also important that we understand that it's about holding white people to incredibly low standards. And of course, I can talk about whiteness versus Blackness as systems of discourses and practices, not just attached to people, but I just want to be very clear about how it does attach to people, because I don't want us to get muddled and forget that there is agency on the part of white people with what I'm talking about. So when I talk about these incredibly low standards for white people, what I'm talking about is if you have a system that constantly puts people of color in the position of defending themselves, right, defending their reputation and saying, well, we're not really criminals, we're not really a drain on the society. If I'm constantly in that position of trying to defend myself from these false accusations, then that means that we never get around to holding white people to actual objective standards at all. I really want us to think about, when do we ever hold white people to objective standards? It's incredibly rare because white people are considered good and decent, period. We never ask, do they contribute to the public good? That would be maybe an objective standard, but we never actually get to that. And this tendency to just assume that whiteness makes you good and decent without any reference to objective standards, that tendency has always been dangerous. But it's especially dangerous now because Donald Trump is so blatantly terrible that simply not being like him is all that white people seem to think about when they're declaring themselves incredibly righteous. So, what I want us to think about in this moment is, if you, for example, claim that you care about something like fair play, my question is, how are you contributing to something like fair play? Does it matter to you that all of the outcomes we're seeing result from incredible unfairness, violent unfairness to Black and brown people? Does it matter? And if so, how can I see that in your actions? How can you, as white people, hold yourselves to actual objective standards? And so I'll end by simply calling out two organizations that I think are very much doing this work. SURGE, which stands for Showing Up for Justice. They have chapters all over the country, all over the United States. I haven't looked to see if they're in Europe as well. But Showing Up for Justice is an organization that brings white people together to educate themselves about how whiteness has shaped their experiences in their country and how they might actually do something that's anti-racist, not simply, I'm not Trump, so I'm good. Another example is White Nonsense Roundup. They're both on Twitter and Facebook, and they have much more material if you Google them. So I just want to shout out those organizations because as we watch COVID-19 ravage the world, I know that what I'm describing about actual standards not being held to people who are considered white, that is part of what is killing so many of us. Thank you.
Thank you very much, Koritha. And I want to turn to Enrico de Lago. Enrico?
Thank you, Dan, for organizing this, and thank you to everybody for being here. And I agree completely with what Kerry and Koritha have said. They have made incredibly important points. But I would like to think about this in a bit of a wider context, in the sense that it is the legacy of slavery and racism that has provoked the crisis at present, but it's also the fact that it's the legacy of the Civil War. Civil War has never gone away from American history, it's still there. In a way, they're still fighting it. And one thing that is clear is that there is a resurgence of the reasons why the South, the Confederate South, fought the Civil War. So it's the legacy of slavery, but it's also the legacy of the fight that the South did to defend slavery. And we can see this at this moment because Trump has been very much a president who had a very ambiguous way of positioning himself toward the history of the Civil War and toward the history of the Confederacy. We can see that from his position in 2016 and 2017, when there were all the problems about the removal of the Confederate statues from various places in the South, and he was very ambiguous about that. And we can see this from the fact that he has made a major point in devolving the power of the federal government and giving more power to the states. effectively supporting states' rights, which was one of the mantras of the Confederacy. And what you see here, therefore, is what one journalist has really called the resurgence of the Confederacy under Trump, because not just Trump, but the entire Republican Party, or most of the Republican Party under him, has become a party that has supported these various ways of harking back to the Confederate past. There are Republican governors in the South, like the one in Mississippi, who is very much somebody who thinks alike. He has declared the Confederate Heritage Month in the middle of the pandemic, which is really incredible. And above all, we all have in mind the images of those protesters who were brandishing guns and were trying to get the states reopened with violence, assaulting the state halls, and basically with Confederate flags, and demanding that they should be respected in their constitutional rights. And this is really something that is possible at this moment because of the current political climate. So what we have here really is a sort of harking back to a past, or to a civil war past, that is coming back to haunt America once again. And another piece by Ibrahim Kendi has made this very clear by making a comparison between the slaveholders' war, which was a war that they waged for the freedom to enslave, and the freedom to effectively not caring about the community. And the same is happening now. These protesters are basically waging their own version of the war, assaulting the city halls and demanding the reopening of the states, because they want what Ibrahim Kendi called the freedom to infect in coronavirus terms. So in both cases, it's a tragedy, because it is about the fact that a large part of the population is going to suffer, and it's African Americans who are mainly in the jobs that are more at risk in the front line. And therefore, by reopening the states, reopening the businesses in the states, African Americans are obviously the ones who are going to pay the cost, and they are going to be the ones who are going to have the largest number of deaths, as it's happening already. And the legacy of the slavery, the legacy of the Civil War, and the legacy of racism has created the situation as we know it at the moment, with a very large number of infected African American communities, a large number of deaths among the African American population. But I think it's important to say that the legacy of the Civil War is never far off, and that effectively white supremacy and the attempt to put down the African American population ultimately harks back to that past and to the Confederate past, which is still very much alive in the South. It never went away, and it's ready to resurrect anytime there is a crisis or a problem, and anytime there is a political climate, as it is at the moment, that allows it to resurrect again and to rear its ugly head. Thank you.
Thank you very much, Enrico. Right, now I'm going to turn to Eric. So over to you, Eric.
Here we go. Okay. Well, thank you for inviting me to take part in this discussion. Needless to say, I am not a physician, I'm not an epidemiologist, I'm just a historian, but as we've already heard, the weight of history is very evident today in the United States and elsewhere, presumably, in terms of the incidence of this disease, this virus. Let me mention just a few statistics about the sharp racial disparities, which have been mentioned briefly, in the impact of the virus in the US. Today's New York Times, well worth looking at, has a breakdown in New York City, the epicenter here, by postal zone or zip code, which shows very clearly that the highest concentration of deaths has been exactly in those regions of New York City with the largest Black and Latino populations, and that many neighborhoods that are affluent and mostly whites have had no deaths whatsoever. In Illinois, 15% of the population is Black, but they represent 43% of the virus deaths. In Michigan, 14% of the population is Black, 40% of the deaths, especially concentrated in Detroit. In Wisconsin, only 6% of the population is African American, but 1/3 of the deaths they account for. I mentioned those last two states, Michigan and Wisconsin, because as Enrico pointed out, they were sort of the centers of the armed demonstrations at state capitals demanding the reopening of the state, the reopening of business, etc. Some of the demonstrators, as we heard, carried Confederate flags until organizers told them this was bad for what media people call optics on TV. But the spectacle of basically all white armed mobs complaining about being inconvenienced by efforts to suppress a disease that is disproportionately affecting African Americans, that spectacle was very revealing. And so was the police response. Just imagine such a large armed group of Black people carrying assault weapons and storming the state capitol in one of these states. The police would certainly not have been quite as hands-off as they were in these cases. But the point is that the high incidence of deaths among Blacks and Latinos reflects the impact of our racial history in the United States, as well as current social realities. The legacy of 250 years of slavery, and soon after the abolition of slavery and the end of Reconstruction, the onset of 75 years of Jim Crow, still has profound effects on American society. For example, the median family wealth of white families, not income, but wealth, is around $180,000. Usually that means basically a home, a house, a car, or some kind of bank account. For Black and Latino families, it's $4,000. The total median wealth of those families is only $4,000. In other words, they have no cushion at all when hard times strike, as they have in the last couple of months. Family wealth, not income, family wealth is the direct reflection of history. In other words, whether history has allowed people over time, families over time, to accumulate economic resources. Black and Latino families have not had that opportunity in the United States. And these populations, of course, are disadvantaged in all sorts of social indicators, whether it's access to quality education, life expectancy, infant mortality rates, unemployment, imprisonment, deaths by gunshots. You can run through all those statistics. They have a higher incidence of asthma, heart disease, and other factors which put you at greater risk from the virus. Of course, I'm old enough to have experienced how and seen how the Civil Rights Revolution changed the patterns of race relations in the United States in important ways, particularly creating a new Black middle and upper middle class. People like Barack Obama, who graduated from Columbia College, where I went to school also, and later Harvard Law School. That path was impossible for almost all non-whites before the Civil Rights Revolution. There were people like Obama who were well positioned to take advantage of those opportunities. But it came pretty late. I mean, as I said, I graduated from Columbia College somewhat before Obama. He's a lot younger than I am. In 1963, there was one African-American student in my graduating class. That was New York City, not Mississippi. And yet it was basically an all-white segregated institution. So was the faculty. There were only 2 Black professors in the entire arts and sciences of Columbia University in 1963 when I graduated. So as I said, these things have changed dramatically on that front, and this sort of Black professional middle class has emerged, which is of course a very good thing. But in fact, today, most African Americans and Latinos still work disproportionately in low-wage jobs, often with no health insurance, and in jobs that cannot be moved to your home. Writers, professors, others apparently can work from home, but most of the jobs that African Americans and Latinos have cannot be done in that way. They are now called essential jobs, which means workers have to continue to perform them even when they involve continual contact with other people. I'm talking about healthcare workers in hospitals, in nursing homes, in the homes of individuals. I'm talking about people working in restaurants, in public transportation, the post office, meat and chicken processing plants. As I say, these jobs are deemed essential now. They are not paid as if they're essential, but they are called essential. So the workers have to continue to work, which means the workers seem to be expendable. And that's one of the reasons why there's been such a high incidence among African Americans and Latinos, just this concentration in these jobs where the virus is set to spread. Of course, the disaster we're experiencing in the US also reflects more general problems, especially with our existing healthcare system. The US spends far more per capita than any other country on healthcare, but with very poor results, whether in terms of life expectancy, infant mortality, or many, many other indices. And the system of not having national health insurance, but linking health insurance to employment is a recipe for disaster. Because what happens, as has now happened, when millions of jobs just disappear? They take health insurance with them, unfortunately, for large numbers of Americans. So let me just finish by saying that the current health crisis in the US is like a massive earthquake, that it reveals and magnifies fault lines, some of which may have been hidden before, other is very evident if one cared to look. But what will follow? What will follow the revelation that these parts of our population are so much more susceptible to disease and death? Hurricane Katrina in 2005 revealed to the nation the deep incidence of poverty among the Black residents of New Orleans. But fundamentally, nothing happened as a result of that. Nothing was done to address the inequalities revealed by Hurricane Katrina and the aftermath. Will it be different this time? I am not terribly optimistic, I'm afraid.
Thank you very much, Eric, and indeed everybody for getting us started with this conversation so powerfully. So if you could sort of put your cameras back on and we'll begin our sort of panel discussion proper. There's so many issues to follow up on, and indeed there are questions and comments coming in that I'll reference in a moment. I guess one thing to pick up on in terms of the points that you've all made is that the crisis began with a sort of messaging about we're all in this together. I mean, there were figures like Prince Charles succumbing, Boris Johnson, and so forth, various celebrities, and so on. And it's quickly given way to a realization that we're not in this all together. And in fact, we may be prepared to live with the fact that some people are disproportionately affected. I think that's one of the major themes that has come out in the discussion already. I wanted to pick up on a point which has come through in a question and to ask Kerry about this. So we have, someone was asking about the phenomenon of protests outside of state capitals. It was noted in relation to Wisconsin and Michigan, for example. And so the person was asking about whether there's a correlation between those protests emerging and the discovery, if you like, that it was disproportionately affecting Black Americans, for example. But in relation to that, I want to ask a slightly more pointed question to Kerry, which was, what about the kind of appropriation of the language of slavery and enslavement by those who have been making the protests? I wonder if you'd say something about that.
No, I mean, thank you, and thank you to everybody. There's so much to discuss here. That is a really important point for us to pick up on. Just let me backtrack a little bit and say it's really vital that we keep emphasizing systemic racism as the cause of these COVID deaths in terms of the way in which and who is dying, because right now already there's this huge pushback to suggest that African Americans are to blame for having higher rates of obesity, higher rates of diabetes, and this is just coming out in the last couple of days. And again, this goes back to slavery. I've got the Journal of John Newton here, who in his own slave trading voyages regularly blames his enslaved cargo for dying of mysterious illnesses of the flux. In no way is slavery ever to blame for high mortality rates. The expendability is built into it. And when we've got this sort of extreme requirement for death built into what we're seeing, it is really horrifying to see, as you say, Dan, the appropriation of "I am a free person, I am not a slave" by white protesters. I think it was Humboldt County over the weekend, the protesters in California there, one woman was holding a placard that had a picture of an enslaved woman with an instrument of torture around her mouth and muzzle. And the woman held the placard saying, this is what the placard said: "Muzzles are for dogs and slaves. I am a free human being." And so this, I mean, there's so much to unpack there, but the idea that enslaved people are not full human beings, the idea that Black bodies are not full human beings, brown bodies are not full human beings. And I think, Koritha emphasized, our speciality is literature. I think we all need to be hyper vigilant for false metaphors, false analogies, false comparisons that will start to proliferate now as the right sees the language of enslavement while they're arguing for their own perverse version of freedom that requires the death of others. So yeah, that's a really important point.
Yeah, that's very helpful. Actually, it takes me to a question I wanted to ask Koritha about societies having, and we've experienced this in Ireland, in Northern Ireland, there societies have acceptable levels of violence. That's one of the things that we discover. And I think maybe it's part of your point is that there's an acceptable level of death seems to be part of the equation. I think you might need to unmute to respond there, Koritha.
Oh yeah, I was waiting for you to finish.
Thank you.
I want to draw a couple things together because you all have, you've made incredibly important points. I mean, part of what was powerful to me about what Kerry had to say is this way that Black people can so easily be blamed for their own deaths. And that's part of what I mean about the low standards for white people too, because given how our public discourse is set up, it's easy to blame Black people for their own deaths. And you even have the Black Surgeon General saying, well, Black and brown people need to not drink so much and do all of that. And all of that seems logical in the American context, despite the fact that the personal choices being put on display by so-called protesters is white protesters outside with guns and not social distancing, but somehow that isn't anything that has us thinking about personal choices that white people make. And so that's what I mean about low standards. And I'm not interested in just, the white protesters who are egregiously appropriating the language of slavery to make their violent points. I'm also interested in what enables that. And it's the idea that run-of-the-mill white people don't actually stand up in anti-racist ways. That is what enables it. So for example, the fact that we have in New York City, New York Police Department reporting numbers where, Black people are something like 25% of the population, and yet they got 89% of the citations for not social distancing. That very racialized policing shows that when police interact with white people, they interact as protectors who are giving them masks, but when they interact with Black and brown people, they're not doing that. I want us to think about how that would be impossible without the consent of run-of-the-mill white people. So that is what I mean about holding white people in general to no objective standard. How are you seeing yourself as contributing to what you say is a fair society? What are you actually doing to address the unfairness? And then the only other thing I wanted to bring up is I so appreciated Enrico's, reminding us of the Civil War and the lost cause and everything that Eric had to say about these disparities. I just want us to remember that part of what we're looking at is how even incremental success by Black and brown people is opposed. And that is part of what, this lost cause ideology is about. And I would argue that the civil rights movement that you're gesturing toward that gave us someone like Barack Obama, the backlash to that is what we're living with. You couldn't have this totally less than mediocre president without the success of Barack Obama. So I just want us to be thinking about how everyday white people can mobilize to make sure that we are actually working toward actual standards moving forward, because Enrico is right that any crisis becomes an opportunity for all of this white supremacy and in fact patriarchal white supremacy, right? Keeping women in general in their proper place. All of those things enjoy a resurgence with any crisis. The only way we're not going to let those old patterns get even more secure is if we are making a deliberate decision to do something different. And so I just really want to encourage us to make the thing that we do differently to actually encourage white people to hold themselves and each other to actual standards.
Thank you. Actually, I also want to pick up on that point by emphasizing that I think there's a danger in the fullness of time that this will be told as a health crisis, the issue about whether it was handled properly by the WHO and so forth, and when information was made available, when in fact it's a social and political crisis. And that's what we really have to learn from at this moment. I mean, once a vaccine is found, in theory, the problem goes away. Well, as the conversation is revealing, the problem is not going away. I want to pick up on something you were saying there and maybe ask a question for Eric. And it's this, I mean, there's so much that's invidious about the Trump moment, but obviously he's escalated matters. Trump and Obama has made a rare intervention by questioning the competence of government without specifically naming Trump. But that obviously has spurred on further commentary and of Trump's attempt to denounce Obama for incompetence and questions about how previous pandemics were handled and so forth. I just wondered if you had any thoughts on that side of the equation.
Yeah, well, I have a lot of thoughts, and I think I commend everyone who's been introducing history, particularly the history of the Civil War and its aftermath here. I mean, after all, Trump became a national political figure by leading the movement to deny that Obama is a citizen of the United States. And, in other words, this was an issue 150 years ago during Reconstruction. It led to the 14th Amendment, which for the first time created birthright citizenship for all, regardless of race, with some consequences eventually that Koritha mentioned. But, that in other words, Trump's whole raison d'etre begins with upholding white nationalism. And even before, his father was well known for racism in the housing world of, paid fines for not renting apartments to African Americans. So this goes way back. I do want to mention that, one of the ways that history affects this debate is that, as others have pointed out, the demonstrators and others appropriating this language of freedom meaning get the government off my back, let me do anything I want, no sense of social responsibility. That's what freedom is. I wrote a whole book about different ideas of freedom in American history. There are others more socially conscious that have been also prominent. But what interests me in this context is that why should people who uphold the notion of the free individual in a sort of libertarian way, why should they be sympathetic to slavery? In a different world, one could imagine them saying, oh, slavery is horrible. Obviously, it's the worst example of taking away a person's freedom. We don't want to have anything to do with the Confederacy or anything like that. That's a violation of individual liberty. That would be a very logical thing to say. But the actual history in the United States doesn't actually encourage that. The notion of individual liberty was always linked to the, as somebody said, the ability to own slaves. I mean, in the American Revolution, you know, most of our patriot leaders were slave owners, even as they spoke about, you know, all men being created equal and enjoying liberty, etc. States' rights, not always, but most of the time, has been linked to either defending slavery or defending racial segregation or things like that. So the actual history of the United States kind of has created this somewhat bizarre link between claims to individual freedom and racism. That's the legacy of slavery in this country. I don't know if it's true in other countries. I wouldn't imagine that people in Ireland who talked about individual freedom would run around carrying Confederate flags in order to exemplify that, because your country has a different kind of history. But you know, the appearance of Confederate flags just is a signal of the depth of the weight of history. That's a mixed metaphor. The power of the weight of history in our discussions even today.
Yeah, picking up on your point about freedom, I certainly agree with you about, you know, they kind of get government off my back. I think for a lot of Americans, freedom is also product choice. And maybe the two things are coming together. You want to be free to go back to shopping so you can have the ultimate expression of your liberties as
McDonald's or Burger King. That's freedom, right?
So there's lots of interesting comments that have come in. Some people have questioned whether we should celebrate Obama and his presidency and what it did for African Americans. But that's obviously a huge topic in itself. That's something we might come back to. I had a question for Enrico, and it's an interesting one that's come in where one of the attendees has asked about the situation for Blacks in Italy specifically. I don't know if you had any thoughts on that for immigrant communities and others in the Italian situation.
The situation for extra-European community, extra-European people in Italy is not great at the moment. Racism is quite rampant in various places. It has become even more so with the rise of the Northern League, which has become the main conduit for these racist attitudes. So it's a part of the way the society is going, which is more or less indicative of the entirety of Europe in a way, because it's divided between a small elite of very wealthy people who are pushing this racist agenda, and they're keeping away from the wealth the larger part of the other people, and especially making sure that Africans and other people from outside Europe are not sharing in this wealth. So the situation is bad. Racism has been actually on the rise as a result of the pandemic. Racism against Asians first, we had to say that, because that has happened in various parts of Italy as a result of the way the pandemic started in China, and then racism against other populations. So it's not as bad as in the US, but the tendency is always there to rise.
Thank you. Yeah, there's actually a comments come in from one of our attendees in the Q&A function, noting that the mobilization of right-wing white policy is happening in the UK through this situation too. The NHS is applauded every week, but Brexit will see the refusal to pay health workers, immigration, or black labor force that support the NHS. That was actually a question I wanted to ask, and it might be one that Kerry would have some thoughts on. I was sort of thinking of this. In the UK, it's every Thursday at 8 p.m. There's the clapping the carers, and beginning with the NHS and extended more widely. And I was sort of thinking of the move from clapping to scrapping under the announcement yesterday by the Home Secretary that they would force through this immigration bill, which would disenfranchise a great many people. I don't know if you had thoughts on that, Kerry.
Absolutely. Well, as somebody with a Trinidadian background and a family who came to the UK to become medical health professionals. That's something that's been in my mind a lot. And I just want to pick up on what Eric drew our attention to and remind us again, which is about the absolutely coexistence of the sense of owning property and whiteness and freedom. And I would suggest that this is part of the UK's philosophical tradition going right back to Locke. And when Edmund Burke said property is a species of liberty, that is really what we see this Etonian Tory government enacting to an extreme degree. And we can really see a direct link, I would argue, between this idea of people as property and Boris Johnson's hypocritical, diabolical request for the Windrush generation nurses. So to come back to the NHS to work on the front line to deal with COVID in this crisis, as he is systematically deporting them illegally to the Caribbean. So just to be clear, under the 1949 British Citizenship Act, all citizens received British nationality, and they were invited to come back and help build the NHS, rebuild Britain after the United Kingdom's, after the World War II. And now they've been illegally deported back to the Caribbean. And so this idea that we own black labour it's more subtly expressed in the UK, but it's certainly there. And that, I just want to say that Ireland, as Eric also pointed out, doesn't have that philosophical tradition, but sadly we've become infected with the white nationalist disease. And I just want to quickly say that we can't let ourselves off the hook when we're keeping people incarcerated in direct provision centres, and when we're leaving travellers, communities without water, without facilities. So unfortunately, while Ireland doesn't have that linked, well, it does have links to slavery, but not to the degree that the UK and the US does. It can't let itself off the hook.
Yeah, actually, I was picking up on your point. I was thinking about how, in a curious way, COVID-19 also gives political cover for certain kinds of things or distracts from other important events. And in particular, the kind of Windrush scandal and the denial of citizenship in the UK was coming to a fore during Brexit. And there's limited space for political attention, even when it's mobilizing opposition. It doesn't allow us to give due attention. So I think that's one of the questions going forward, is about how these issues of social justice may get overwhelmed by sheer issues of getting economies restarted and the scale of the crisis and so forth. There's various different comments. I just wanted to, yep.
If I could piggyback on that, just because, and this actually may go to something that you were going to go to anyway, because I saw it in the Q&A. Someone was asking about lower class, uneducated white people who are proud of being ignorant and racist, and how that goes along with my low standards for white people comment. And I just want to quickly address that, especially given what you just said and what we've been talking about in terms of how a crisis moment, allows for a reification of all of the worst tendencies. And I just want to say, and it links again to what Eric Foner was saying, this idea for me, I think in terms of how the United States, in getting from President Obama to Trump, I call it that we moved from having a mom-in-chief to a predator-in-chief, that we, what is the best way to show women, especially women of color, that the American dream may be for straight white men who, violate institutions and people, but it's not for you. One way to do that is to empower this person who made their campaign based on birtherism and then also got exposed as a sexual predator. And the reason I bring that up in terms of this low standards for just ordinary white people is because Trump initiated his campaign by calling Mexicans rapists. And so what I want us to think about is how it is that ordinary white people were okay with empowering someone who would obviously endanger people of color. It was okay because a strong anti-racist orientation was not the standard they were holding themselves to. And so I just really want us to take that very seriously, that we have to operate differently. And I want to suggest that that would be a way of operating differently, to think about what are our actual standards, what do we actually believe a country and society should be, and are we actually doing anything in line with that, or are we being passive just because we're not the worst example of what we're calling ignorant and racist?
Thank you very much. I'm just going to allude to a couple of comments that have come in, and with apologies to the many that have written. One person is writing, Gina Pagan, about the appropriation of the concept of freedom amongst white nationalists is not actually about freedom, it's about power and the continuation of white power. Another person attending says, Emmanuel Carrillo says, thought Trump himself has set the linguistic stage for the appropriation of language surrounding the virus, i.e. the Chinese virus. That's obviously very much in play. I suppose it takes us to a further question which has come in, which is, if I can just pick up on its general point, which is about, I suppose, what's going to happen in the US election. For those based there might wish to comment on it, or indeed Enrico. This is a very difficult moment in which to run any kind of a campaign. The questions that have come up today will be very much potentially election issues. How do you think they're going to be handled? Do you have any prognostications in this difficult situation? I know maybe Eric, you might have some thoughts on that.
I'm usually wrong when I predict the future, so I don't want to be held to it. I mean, I think a lot depends. Right now, you know, the majority of people seem to feel that Trump has mishandled the situation, which of course he has, and his so-called approval rating has fallen, even though it's pretty high for a guy who has no qualifications for the office he's holding. But you know, a lot depends on what the situation is. If we can imagine that in October, we have a vaccine around, that the virus is no longer spreading the way it is, the death rate is much lower. If we can imagine that, Trump will be able to say, hey, we defeated this, you know. Most doctors don't seem to feel that that's a likely scenario. And if the situation is still what it is today, with people very, very nervous, very, very concerned, whether they statistically are likely to get it or not, people are not, you know, wanting to go to restaurants or theaters or things like that, then I think it will certainly redound against Trump's reelection. But, you know, my basic feeling right now is, and you can prove me wrong if you know, most people have decided Trump is a known quantity, and his poll ratings have not budged actually very much at all in the last 2 years. About 42% of the population approves of him, about 48, 49% don't, say 50%. There's a certain number of undecided, not that many. People have decided already what they're doing, and more of them appear to have decided that they don't want him anymore. Now, of course, there are efforts underway to suppress voting, to make it impossible for Democrats, whether they're non-white or not, to vote, and that's happening in important states. So, you know, the polls may not reflect what the actual electoral turnout is when you have a lot of voter suppression going on. That's a wild card, which is very hard to predict at this point.
Yeah, that was a point raised by one of the questioners too. It was interesting in the case of George Bush that Katrina obviously happened in his second term. It did seem to be a turning point in terms of attitudes towards him. But on the other hand, as you were saying earlier, it's not clear that it actually changed anything per se. There's no test because he wasn't up for re-election after the mishandling of that.
Well, if you look at New Orleans, the city and the incidence of poverty and housing conditions and others didn't change very much after Katrina. The main change was a lot of Black people were evacuated and never came back. And so New Orleans is a much whiter city now than it was when the hurricane hit.
Yeah, I worked for a while for the Times-Picayune, so that's familiar to me. Koritha, yeah, you wanted to come in there, so.
I just wanted to chime in because the point of voter suppression is so incredibly crucial here. I mean, one example that we saw recently in Wisconsin was basically, you know, shutting down polling places and then forcing people to basically choose between life and voting and going out and actually standing in those lines. And sure enough, the vote went more Democratic. And so we also have heard Trump admit something that, you know, white supremacists and Republicans rarely admit, which is if you had mail-in voting, if that became the thing, a Republican would never win again. So I think this is really, you know, underlying the kind of work that Carol Anderson has done in helping us understand that voter suppression has always been the mode of this country. And I want to make that link to holding white people to low standards again, because part of the point that Carol Anderson makes is that a Democratic presidential candidate hasn't actually won the majority of white people's votes since 1964. Even Jimmy Carter, even Bill Clinton, sons of the South, did not get the majority of white people's votes. I want to link that to low standards for white people because I want us to really seriously think about what we mean when we say, well, things have really changed because, I mean, Americans voted in Obama twice. That vote did not reflect the majority of white people. So I want my white fellow citizens to take seriously holding themselves and holding each other to higher standards, because of course my holding somebody to a standard doesn't matter. It's if you're going to hold yourself and each other to higher standards.
Thank you very much. I actually wasn't aware of that in relation to Carter and Clinton. Extremely interesting. We're coming towards the end of our time. I see Kerry has her hand up. So Kerry, please do.
Are you sure? Okay. Well, sorry, there's so much to pick up on everything that everybody said, but I just wanted to say, chime in with Koritha there and to say, you know, one of the real challenges, I think, for what she's calling for, rightfully, for sort of white awareness, white consciousness, is this idea of these false analogies between oppression and simply, as Eric said, inconvenience. And again, I think this goes back to slavery. Don't forget, slavery was, you know, the system was created to produce what we do not need. Sugar, you know, these luxuries that we do not need at such high cost. And we see people standing outside Baskin Robbins. We see people going with hand grenade launchers into Subway. You know, what American people are counting as freedom is consumerism that's also not good for them. And I just wanted to draw a quick point out about class and race. I think the next stage is to keep thinking about the way in which the working class and the unemployed, 33 million now unemployed, has probably gone up, you know, in the United States. What's going to happen to this massive underclass with no safety net? It's going to take a coalition, as Koritha is calling for, that really calls for some awareness about what rights really are. So anyway, thank you.
Thanks, Kerry. Yeah, I just wanted to go through a few comments as we come to a conclusion and just to acknowledge some of the things that have come in.
Can I just comment on one thing?
Yes, please, Enrico. Yeah.
I just want to say, besides the human cost, which is absolutely appalling, I think the biggest problem will be the massive economic crisis that will happen after this is over. And that will influence the American history for a long time. Because if the predictions are right, that the incidence of unemployment will be much worse than in the Great Depression of 1929, anybody who is in power will have to deal with that and will have to deal with that for several years. I don't know if Trump will survive that, but whoever comes after him, it will be the same. It will be an unmanageable emergency situation for decades. So we have to think about that in that context as well, that when the emergency is finished, the long-term consequences of these are going to be massive on the entire American society, and they will stay there for a long time.
That's a good point. And I mean, certainly in the case of Obama, the presidency that he might have imagined was immediately reshaped by the financial crisis that arrived as he took office. Just as I say, to acknowledge a few comments that have come in. Gregana Stefanova says, I'd like to comment on the hypocrisy behind governmental intervention in Indigenous and Aboriginal affairs under the pretext of protection and development. Yet when a crisis like COVID occurs, non-white people are pretty much left on their own. In a time when leaders call for unity and collaboration, is COVID not exposing the need for sovereignty more than ever? Another person says, so what now, what next? We have all this information and amazing intellectuals, but very little change. I urge you all to push harder, use your influence. Alistair Welchman says, maybe what we're seeing now is disaster white supremacy on the model of Klein's disaster capitalism. It's an interesting observation. A couple of other points from colleagues. Kevin O'Sullivan here wanted to thank Kerry for mentioning direct provision, which is an issue in Ireland. He noted the kind of political cover at the moment. He said it also gives a moral cover for societies to applaud themselves for their actions, but to ignore deep-rooted long-term failings. But in the case of direct provision, largely out of sight, which is a very good point. We have other questions. There was another one that I did want to acknowledge from Margaret Breheny, who will be known to colleagues here. Margaret has her PhD from NUI Galway, and Margaret is doing research in Cuba at the moment. And she thanks the panelists, and she says she's tuning in from Havana, where universal healthcare has succeeded in minimizing contagion. With a population of 11.34 million, 79 people have died. We are now 5 days without anyone dying, and only 9 cases yesterday. I can't do justice to all of the things that have come in and all of the issues that the panelists have raised and the thoughts that they've stimulated. All I can do really is to thank you all on behalf of the many people attending. A recording of the session will be available, and I'm sure it'll provoke further comment and discussion. Thank you for an extremely important and valuable and necessary conversation. So with that, thank you again all for attending and for the panelists for your contributions. Thank you.